Hello, YouTube, and welcome to my channel. Are you a Black woman seeking to have medical treatment or a procedure abroad? Well, this channel focuses on medical tourism for Black women. So if you're interested in learning about things like cost, pre and post surgical care, treatment, medications, therapy, and follow up, anything like that pertaining to medical tourism, make sure you subscribe to my channel and hit the notification bell so you're notified when I post a new video. My name is Dr. Natasha Ramental, also known as the Medical Tourism RN. I'm not a physician, but I am a doctoral trained registered nurse who's worked in the emergency department and the post anesthesia care unit for a number of years. So on my channel, I cover all aspects of medical tourism for Black women if they decide to seek healthcare or treatment abroad for things from cosmetic surgery to cancer or fertility treatment and beyond. But I created this channel so that Black women will make the most informed decisions about their healthcare to have the best outcomes and the best experience they can. So, one of the things that I wanted to do before I forget is make sure I thank you all for the overwhelming support for my first video, Things Black Women Need to Consider with Medical Tourism. And if you haven't watched it yet, I placed the link in the description, so please be sure to check it out. But today we're going to actually talk about dental procedures. So, based on comments I received from my first video, it was requested that I cover dental procedures as a number of you seem to be going to have dental procedures in another country in the near future. So I'm going to cover 9 things Black women need to know before you travel abroad for dental work. And for a bonus, be sure you stick around until the end of this video because I'm going to share the top destinations for dental procedures and you don't want to miss it. So let's get into it. Number 1, you need to determine whether you need a generalist or a specialist. So you need to differentiate whether you're looking for a general dentist for things that are more like maintenance, cleanings twice a year, ongoing care, versus something a little bit more complex, reconstructive surgery or cosmetic oral surgery. So once you differentiate between that, it'll help you with your search for the appropriate dentist. Number 2, cost. So the cost of dental care can actually fluctuate significantly from case to case and based on a variety of factors. For example, and I'll give you an example in the US. Say in Beverly Hills in California, they may charge 25% more for the same treatment that's actually performed in outlying areas like Thousand Oaks, which is about an hour away from Beverly Hills. Why? Well, it may cost a practice significantly more to operate in an area like Beverly Hills because it's upscale, and those costs are actually shared by you, the patient. So before selecting a given dentist or dental practice, you would want to make sure that you get estimates. And I gave an example in the US, but this holds true in other countries as well. So I know many of you may go to Central America or Europe for dental treatment. Think about the cost of a practice in a major city, maybe the capital, versus in one of the outlying areas. Also, if you do not speak the language, the cost tends to increase because of your need or your desire for an English speaking dentist. Number 3, training. So you need to research the extent of training and clinical experience that a potential dentist has, particularly with regard to specialty procedures. For example, not all dentists are trained in performing the full array of cosmetic or restorative procedures, and they may in fact refer certain cases to colleagues. So a referral may be a less convenient option for you if you're actually traveling for this procedure. So there are other things that you need to consider, like additional costs, more time that you need to be there, additional follow-up, all those things. But I encourage you to find out these things prior to traveling by having a discussion with the dentist or the practice that you plan on seeing. Number 4, referrals. General dentists may or may not have the ability to take on more complex cases. So they may actually refer you if it's a cosmetic case or something complex like that. And they may not be equipped to provide certain treatments. So if you're concerned with a scenario in which you are referred to another dentist for treatment, you should inquire as to the specifics of the referral process. It differs greatly from country to country. Do not go expecting it to be similar to the US. This will help you prepare as much as possible prior to your travel rather than any unexpected surprises when you arrive. Number 5, treatments offered. Okay, so not all dentists or practices offer the same services. So if you're looking for a specific treatment or a specific product brand, it's imperative that you actually inquire as to whether a given practice actually provides that. For example, you may have seen those clear alternative to braces, Invisalign. Though, if you're interested in that particular procedure, although your dentist may offer invisible braces solutions that are similar in function and quality to Invisalign, they may not be certified to provide Invisalign specifically. So Invisalign has trained orthodontists for their products. So if this is important to you, then this is something you need to consider during your search when you're looking for a dentist. Number six, and I'm looking at my notes to make sure I don't forget anything, guys, but emergency care. This is really important because dental emergencies happen, right? You can go and receive treatment during the day, and then in the evening, you may be eating something or something happens. But oral trauma and damage restorations can occur at any time. So it's important that you know what sort of recourse your dentist or your practice offers in case of emergencies. So, for example, some practices may offer flexible hours and weekend appointments, whereas other practices may be limited in their flexibility. So, in those cases, what do you do? Should you be going to the nearest emergency room at a hospital? These are things that you need to ask before you even travel to the country. Number seven, dental technologies. So, some dentists do not like investing in new technologies, and some of them actually do because to them it improves the patient experience. It enhances the treatment process. But some dentists are hesitant to invest because of the money that goes into purchasing new equipment like lasers and other machines. So although these technologies are not necessarily improving your treatment outcome, they can have impact on aspects of your treatment experience for things like the amount of chair time, the number of visits that are required for a particular procedure. So keep this in mind. A practice also that's offering cutting edge technologies may charge more than a practice that's offering more traditional treatment options. So it's up to you to determine what's best for you. Number eight, patient comforts. This is something that's important, particularly if you are a person that is anxious, or maybe you're just anxious when you go to the dentist. If you are, you're not alone. But dental anxiety is actually really common to the point that many practices start to offer variety of services that cater towards patients' comfort. Things like pre-medication and what's commonly termed as laughing gas, which is nitrous oxide. They may offer you that, or may offer you things like some practices go as far as offer headphones, massages, aromatherapy, and so much more to help patients put patients at ease. But you're going to want to ask about what sort of patient comforts the practice offers during your initial consultation. Number nine, before and after photos. So most dentists actually keep a gallery of past patients that includes pictures of their teeth before and after treatment. This can be extremely helpful to you when you're evaluating the quality of the work that you can expect with a dentist. Also, if your needs are cosmetic, this is going to be really helpful for you when you're evaluating all your cosmetic options, including things as simple as maybe teeth whitening to something a little bit more complex like implants or porcelain veneers, something like that. I would also ask if they have any before and afters of Black patients. It's okay to ask. If they don't, fine, but you should ask. Okay, you get a better sense of their work and seeing it on someone that has the same shade as you. Okay, so those are the 9 tips. Some other things that I just wanted to bring to your attention that are really important are things like gum disease. So, as a Black woman, you need to be concerned about periodontal disease. It's also called periodontitis and gum disease, but it's essentially a progressive disease that affects the supporting and the surrounding tissue of your gums and also your underlying jawbone. If it's left untreated, periodontal disease can actually result in things like loose teeth, unstable teeth, and tooth loss. The thing about periodontal disease is that it cannot be reversed. it actually can be managed through treatment to help you avoid some of the more serious side effects like receding gums and tooth loss, which obviously affects our self esteem and our confidence when we don't want to smile because of the condition of our teeth. So I mention this because we don't want it to progress. But then the other thing is, I bring this up because which ethnic minority in the US do you think is most at risk for periodontal disease? Ding, ding, ding. Black adults, right? So, Black adults are actually more likely than any other racial or ethnic minorities to have periodontal disease. So, this is why I brought this up. And there are three known causes for periodontal disease: smoking or chewing tobacco, poor oral health habits, and also gingivitis, which is a form of gum disease that causes inflamed gums. Okay. Another reason why periodontal disease is important is because there's actually a link between periodontal disease and hypertension or high blood pressure. Okay. And there's also a link between periodontal disease and diabetes. And once again, who do you think has the highest rates of hypertension and the higher rates of diabetes? Ding, ding, ding. Black people. Okay. But particularly when it comes to hypertension, 2 in 5 Black women, or 43%, actually suffer from hypertension compared to 27% of white women. Blacks also have a disproportionate burden of diabetes. So in the US, Black adults are 60% more likely than white adults to be diagnosed with diabetes. And a study revealed that non Hispanic Blacks were found to be twice as likely than non Hispanic whites to die from diabetes. So that association is really important for us to know about for those reasons that I stated. And particularly with Black women, there is also another study about how gum disease and tooth loss, how Black women face a higher risk of pancreatic cancer from that. So I just want to make sure that you are fully aware of everything that is involved, and before you go for treatment, things to look for even after treatment to make sure you're keeping up with your dental health. And I'll leave information in the description box on the studies that I found, particularly on that. Okay, so all right, I did promise I was going to share the top 9 countries for dental care. I want to make sure I share that with you. So the best countries for dental tourism. Number 1, India. So India is considered the best place in the world for dental tourism, partly because the prices for dental care are about 70% lower than the States, the US. Okay, so many of the top clinics actually have international accreditation, and they also have partnerships with many Western hospitals. The biggest thing here is that the advantage India has over other countries that are on the list is that the number of English speaking medical professionals. So India has the second largest English speaking population outside of the United States. So you won't have any trouble finding an English speaking dentist. Something to consider though is distance and the procedure that you're actually going for, and whether you will need to follow up, because all of that will factor into your cost of travel. Number 2, Turkey. So, Turkey is one of the best places to travel for your dental needs, particularly Istanbul, which is Turkey's largest city. So, many people have had really great success with their dental procedures for a far more reasonable cost. But according to Patients Beyond Borders, Turkey is one of the top 10 destinations for dental tourism for Americans. And they're the top destination for dental implants as well. Number 3, Hungary. So Hungary is one of the top dental tourist destinations in the world because it's a favorite among Europeans that are actually looking for high quality, low cost dental treatments. The thing is, the prices are about a third of what you pay in the US or other European countries. So it may not always be the best option for Americans due to cost, but there's still a possibility for you to save some money for you to visit and have major treatment done in Hungary. Okay, number 4, Mexico, which I know is a huge popular spot for dental tourism for Americans. A couple years ago, it was estimated that 6.5 million people actually traveled to Mexico for dental treatment. Out of that 6.5 million, 1.1 million were actually from the United States. So Mexico isn't necessarily the cheapest destination on the list, but the savings are still good. It's about 50 to 60% of what you would pay in the United States. And it's the only destination on the list that you can actually drive to from the United States. So it's the most affordable to reach, but also you can subtract things like a long flight from your bill. And also its proximity to the US can allow you to save time as well. Number five, Thailand. So Thailand actually sees more tourists than any other country in Southeast Asia. Recently, medical and dental tourists have actually started seeking treatment in Thailand because they have world-class dental facilities and medical facilities. And on average, you can save about 60% of what you'd pay in the US for dental work. So the best place to go for dental tourism in Thailand is Bangkok. The city is pedestrian friendly. There's a sky train, which is the best way to travel across the city. Also, for shorter distances, taxis are affordable and very easy to find. Number six, Colombia in South America. Now, when we're talking about Colombia, there are a couple different cities within Colombia: Cartagena, Bogota, and Medellin. They actually offer dental treatment that's at affordable prices, and you can expect to save about 70% of what you'd pay in the US. Colombia is also a top option for medical tourism. They're ahead of the curve when you're talking about medical and dental care. Their clinics are equipped with the latest technology, and there are also plenty of English speaking medical professionals. And they also offer a number of package deals that are available. Now, Colombia is actually a safe country. I know a number of people think about other things they've heard, cartel, etc., but it's a safe country and a great place to spend time. As a matter of fact, I'll be going there next week, so I'll probably have something to share with you guys soon on that. But expats have been relocating to Colombia for years, and many report feeling safer than they did in the US. Also, the US dollar is strong against the Colombian peso, meaning your money will go farther. Okay. Number seven, Panama. So dental care in Panama costs about 50% the rate that you pay in the US. It's also easy to find English speaking dentists and make appointments there. Panama City is probably the best place for dental work in the country, with a range of top tier clinics and dentists, but you'll find better prices in the countryside. The only thing that I would caution you against is be careful because the standard varies outside of the capital. So do your research. Okay. Booking a flight to Panama and finding a hotel and sourcing a dentist are very easy. Also, Panama's currency is the US dollar. So you don't have to work out any exchange rates. So it's quite easy. Number eight, the Dominican Republic. So that's a top destination for dental treatment. The DR actually specializes in cosmetic procedures as well, on top of dental implants. But dentists in the DR take their time to ensure the job is done properly and that all the patient's questions and concerns are addressed. Okay, so there you have it. You have the top eight countries for dental tourism. Now, that's on a whole. There's also a list of countries that are best known for dental implants if you need to have dental implants, because that's a bit more complex. And I'll just run through that list pretty quickly because honestly, much of the list overlaps with what I just shared with you. So, number one, Turkey, no surprise there. Number two, Hungary. Number three, Croatia. Number four, Czech Republic. Number five, Mexico. Number six, Germany. Number seven, Thailand. Number eight, United Kingdom. And number nine, India. Okay. So, as always, I encourage you to do your research. Check the accreditations of the clinics that you're considering. Many sites post reviews from customers, and you could read them. You should read them. There also are expat and repat sites that and travel sites that usually have a Q&A page. So post your questions, and people are more than willing to share their experiences with you. So don't get obsessed with savings. I know a lot of times people are leaving the US for treatment because of the cost of treatment in the US being so expensive. But if a clinic is notably cheaper than others in the same country, consider that a red flag. Okay, so until next time, be well. And also let me know about your dental experiences in another country if you have any that you want to share. And don't forget to subscribe and click the notification bell so you know when I post the next video. Okay, until then, later. Thank you.